Hello everyone and welcome back. My name is Dr. Ben Osevwe, DNP-PMHNP. Today we are talking about Escitalopram, also known by the brand name Lexapro. This video is for education only and does not replace medical advice. Please do not start, stop, or change medication without speaking with your prescriber. What is Escitalopram? Escitalopram is an SSRI, which stands for Selective Serotonin Reuptake Inhibitor. In plain language, escitalopram helps serotonin stay available longer between brain cells. Serotonin helps with mood, anxiety, emotional regulation, sleep, appetite, and stress response. Escitalopram is often thought of as one of the cleaner, more straightforward SSRIs. That does not mean it has no side effects. It just means it is commonly used because many patients tolerate it well. Think of escitalopram like a calm, organized friend who says, "Let's breathe, make a plan, and stop catastrophizing because one person did not text back." What is escitalopram used for? Escitalopram is commonly used for major depressive disorder and generalized anxiety disorder. It may also be used off-label for panic symptoms, social anxiety, OCD symptoms, PTSD symptoms, or other anxiety-related conditions, depending on clinical judgment. When patients ask, "Why am I taking an antidepressant for anxiety?" explain, antidepressant is the medication class name, but serotonin affects both mood and anxiety. That is why we use SSRIs for more than depression. That one explanation can reduce fear and stigma. How escitalopram works in the brain. Brain cells send messages using chemicals called neurotransmitters. Serotonin is one of those messengers. Normally, serotonin sends its message and then gets taken back up. Escitalopram slows down that reuptake process, allowing serotonin to remain available longer. But it does not work overnight. A common timeline is week 1 to 2, body adjusts, side effects may occur. Week 2 to 4, early improvement may begin. Week 4 to 8, fuller improvement may be seen. Beyond 8 weeks, further adjustment may be needed. In 1 week, do not panic and say, "It failed." At 1 week, Lexapro may still be introducing itself to the brain like, "Hi, I'm here to help, please stop screaming." Board exam pearl. Remember that escitalopram is the S enantiomer of citalopram. It is more potent and often better tolerated because it has less antihistaminic activity, meaning less sedation. Let's look at the DSM-5-TR criteria. For generalized anxiety disorder, we look for excessive anxiety and worry for at least 6 months about a number of events or activities. For MDD or major depressive disorder, we need at least 2 weeks of depressed mood or loss of interest, along with other symptoms like sleep or appetite changes. Starting dose, titration, and maximum daily dose. For adults, a common starting dose is 10 mg by mouth once daily. For sensitive patients, older adults, or those prone to side effects, some prescribers may start at 5 mg once daily. Titration may be done by increasing from 5 mg to 10 mg, or from 10 mg to 20 mg. The usual maximum daily dose is 20 mg per day. Simple dosing summary. Starting dose, commonly 5 mg to 10 mg once daily. Titration, increase gradually. Maximum daily dose, 20 mg per day. Dosing is individualized. We are not trying to max it out just because the prescription pad allows it. Medication is not a gym machine. More weight is not always better. How patients usually take escitalopram. Escitalopram is usually taken once daily. If it causes sleepiness, nighttime works better. If it causes insomnia, morning works better. Patients should take it daily, not only when anxious. Escitalopram is not a rescue medication. It is not an emotional Tylenol. It works gradually. Common side effects may include nausea, headache, fatigue, sleepiness or insomnia, dry mouth, sweating, sexual side effects, feeling jittery early on, and appetite or weight changes. Many early side effects may improve as the body adjusts. Sexual side effects should be discussed openly. You can say, Some people notice changes in libido, arousal, or orgasm. If that happens, please tell me. There are ways we can manage it. That is better than letting the patient go home thinking, well, my anxiety is better, but my love life is now at 2%. Case study: meet Sarah, a 32-year-old PMHNP student. She reports persistent worry about her clinical rotations and board exams. She's starting 10 milligrams of Escitalopram. We'll monitor her for the 2 to 4 week activation window and check back on her progress. Important safety warnings. Monitor for suicidal thoughts and behavior, especially in young adults. Screen for bipolar disorder before starting. Watch for serotonin syndrome and review drug interactions. Avoid sudden discontinuation as it can cause dizziness, irritability, and anxiety rebound. What families should understand. Escitalopram is not meant to change personality. The goal is to help reduce symptoms so the person can function and handle stress better. Medication lowers the volume of symptoms so skills can work. If anxiety is screaming at volume 10, coping skills may not stand a chance. If it's at volume 5, now therapy and lifestyle changes have room to work. Teaching points. Number 1. Explain uses for depression and anxiety. Number 2. Teach the timeline. Number 3. Include dosing, 5 milligrams to 20 milligrams. Number 4. Screen for bipolar disorder. Number 5. Ask about sexual side effects. Number 6. Monitor for activation and worsening mood. Number 7. Encourage daily use. Number 8. Keep the explanation simple. Let's bring it all together. Practice question 1. A patient starting Escitalopram asks when they will feel better. What is the correct teaching? A. Immediately. B. 24 hours. C. 2 to 4 weeks for early improvement. The answer is C. Serotonin levels adjust gradually. It's critical to set expectations so patients don't stop the medication prematurely because they don't feel different on day 3. Practice question 2. What is the usual maximum daily dose for escitalopram in adults? Is it 10 milligrams, 20 milligrams, or 40 milligrams? Take a moment to think. The answer is 20 milligrams. While some specific clinical cases may differ, 20 milligrams is the standard recognized maximum daily dose. Remember, titration should always be gradual. Escitalopram, or Lexapro, is an SSR, used for depression and generalized anxiety disorder. It helps serotonin stay available longer. A common starting dose is 5 to 10 milligrams once daily. The dose may be increased gradually up to 20 milligrams per day. Escitalopram is not magic. It is a tool. When combined with therapy and support, it helps people feel more stable. Thank you for reading. My name is Dr. Ben Osevwe, DNP-PMHNP. For support, you can text 832-9916516. Please subscribe to our YouTube channel for more educational videos. Join our mentorship family today at rotationmatchnetwork.com. And remember, anxiety may be loud, but with treatment and support, it does not have to be in charge.